everyone, welcome to East Tennessee & Company. I'm Sherry Ayler. Like many conditions that once were accepted as part of getting older, cataracts can now be corrected in most cases. Cataract surgery is one of the most common and effective operations performed today. Campbell, Cunningham, and Taylor are among the first doctors in the Southeast to perform the Crystalens procedure, which can correct vision at all distance. Joining us today to tell us more about it is Dr. Les Cunningham from Cunningham, Campbell, and Taylor. Thank you for being here today.
Good to be here.
Well, tell us what is Crystalens and exactly what does it do?
Well, Crystalens is a newer, and I say newer, it's been out probably 4 or 5 years, type of lens implant that's used in cataract surgery. As you know, cataracts are a really common condition of aging, one of the leading causes of vision loss in older people, and we have to put a lens implant when we do cataract surgery to replace the lost focusing power of the lens we're taking out. And Crystalens is probably the latest, greatest type of lens implant. Okay,
then what makes it different from the older ones? What makes it so much greater?
What makes it different is that unlike a standard lens, which can help you see well at distance, a crystal lens actually has the ability to flex and move inside the eye to mimic the focusing muscle of the eye. As you know, we start getting into reading glasses and bifocals in our 40s, and that's because the lens in the eye is getting stiffer. Mm-hmm. We can find a way to harness the power of the focusing muscle after we remove the natural lens. Then we can actually restore some of the lost distance, especially at intermediate and maybe even up close.
You have one of those lenses. Can you give us a quick little idea of what you mean by...
Sure. This is a large-scale model, obviously, of the crystal lens, and the positioning parts of the lens are these pieces on the outside, and the focusing part is like a contact lens or a glasses spectacle lens in the middle, and this lens is hinged, so when the focusing muscle of the eye goes to move, the lens actually flexes and arches in the eye a little bit, and when it does that, it actually brings things into focus up close.
Okay, well that's a good example. Now, who should have Crystalens, and how would a person know if actually they're a candidate?
Well, the first thing that I think is important to emphasize is that everyone needs regular eye checkups, because there are other things besides cataracts that can occur as we get older, things like glaucoma and macular degeneration. And so it's important for everyone to be checked on a regular basis. And we do a complete eye exam when patients come in, and if we do diagnose cataracts, we discuss the risks of the surgery, which are important to go over with your doctor. And then we just discuss different implant options for the patient. And there are multiple choices, the crystal lens being one of many, but probably the most advanced lens that we have now.
Well, a lot of viewers are going to want to know, does insurance cover the cost of this?
Typically, it does not. It will cover the cost of the surgery itself, and in most cases they may provide a small supplement for some of the newer lenses, but the sort of state-of-the-art lenses like the crystal lens typically are not covered by insurance.
Okay, and it corrects the vision to 20/20 for both distance and for up-close reading in most cases?
We certainly, no physician can guarantee any result, of course, but we found, and national studies have borne this out, that about 75% of patients that have this lens are glasses-free at most distances most of the time. This lens really excels at distance, and especially at those intermediate distances like computer, arm's length, makeup, dashboard, grocery shopping.
Well, we appreciate you coming in to share this great information with us, and we would like to encourage you to go up to our website, EastTennesseeandCompany.com, and we're going to have a connection to yours, which is ccteyes.com, and then you can also call them and book an appointment for whatever you want to talk to them about. We want to thank Campbell, Cunningham, and Taylor for sponsoring today's show. Thanks, and join us again.